So hello guys, welcome to my channel. Today we are continuing the series of gynecology AIAPGT preparation. So let's continue. Lochia, offensive fishy smell discharge of puerperium. 1 to 4 days Lochia rubra. It is in red color. Okay. And 10 to 15 days Lochia alba, pale white color. Please do remember the colors according to the days. At the end of second week, uterus becomes a pelvic organ. Okay. Next we move to the amniotic fluid. Amniotic fluid color. Early it is colorless. Late it is pale straw color. Green meconium fetal distress. Golden RH incompatibility. Greenish yellow or saffron post maturity. Dark hemorrhage. Dark brown or a tobacco juice color indicates intrauterine death. Amniotic fluid, it is alkaline. Specific gravity is 1.01. Next we move to definitions. Dysmenorrhea means painful menstruation. Then primary amenorrhea. Women is not menstruate by the age of 16 years in the presence of secondary sexual characters. And 14 years in the absence of secondary sexual characters. Then secondary amenorrhea. Women is menstruating at first and does not menstruate for period of 3 menstrual periods. Okay. Menorrhagia, excessive bleeding. Metrorrhagia, acyclic or intermenstrual vaginal bleeding, though not excessive in amount. Remember, menorrhagia and metrorrhagia, they are a bit confusing. Menorrhagia means excessive bleeding. Metrorrhagia, metro means metro, just remember as a middle. Okay. The intermenstrual bleeding means in the middle of menstrual cycle, again you can see the bleeding, that is metrorrhagia, middle of the menstrual cycle. Menorrhagia is excessive bleeding. Metrorrhagia is acyclic or intermenstrual vaginal bleeding, though not excessive in amount. Next, hypomenorrhea, scanty menstruation in the form of only a drop or two. Then leukorrhea, white discharge, commonly called as common cause is moniliasis, also called as candidiasis. Next, hirsutism is development of coarse pigmented hair on face, upper back, chest and abdomen. Then galactorrhea is expression of milky fluid from nipples, can be unilateral or bilateral. Okay. Next, LMP. LMP is last menstrual period. EDD is expected date of delivery. EDD is calculated from LMP using Nagel's rule. EDD is equals to LMP plus 9 months plus 7 days is expected date of delivery. Then ectopic pregnancy, fertilized ovum implanted outside the uterine cavity. Common site is fallopian tube. APH, antepartum hemorrhage, is from genital tract after 28 weeks completed of pregnancy. Postpartum hemorrhage, blood loss more than 500 ml. It is considered as a postpartum hemorrhage. Then primary, before and after expulsion of placenta in first 24 hours. Secondary, beyond 24 hours but in puerperium. Then PIH, pregnancy induced hypertension, is called when BP is more than 140/90 with edema, commonly pedal edema and edema of the face. Okay. Next, RH negative gravida. RH isoimmunization is a process of development of RH antibodies in an RH negative person due to introduction of RH antigen from outside. Next, polyhydramnios. Amniotic fluid is more than twice the expected volume for gestational age, more than 2 liter anytime. Liquor amniotic exceeds than 2000 ml. And AFI, amniotic fluid index more than 20 cm. These all criteria comes under polyhydramnios. Then oligohydramnios, diagnosed with when amniotic fluid volume is less than 300 ml at term or less than 100 ml. Next, short cord, less than 20 cm. Next, hedatiform mole, cystic degeneration of chronic villi. Small p to large grape size. Hedatiform mole is a mass develops in the uterus at the beginning of pregnancy instead of a healthy embryo. Next, uterine prolapse. Uterus is said to be prolapsed when cervix lies below level of ischial spine. Degree side, first degree, cervix between ischial spine and introitus, vaginal opening. Second degree, cervix at introitus. Third degree, cervix below introitus, fundus above. Fourth degree, fundus below introitus. Then placenta previa is implantation of placenta in a lower uterine segment. Painless vaginal bleeding. Normally, placenta attached to posterior wall of the uterus. Degrees. First degree, lateral, one wall of uterus reaching internal os. Second degree, marginal, one wall of uterus reaching internal os. Third degree, incomplete, central, crossing internal os but not cover it after dilatation. Fourth degree, complete, central, cover internal os even after full dilatation. Miscarriage. Abortion is termination of pregnancy before the period of viability and is considered to occur at 28th week. Threatened abortion. It is clinical entity where the process of abortion has started but has not progressed to a state from which recovery is impossible. Then complete abortion. When a product of conception are expelled, it is called complete abortion. Missed abortion. When a fetus is dead and retained inside the uterus for a viable period, it is called missed abortion. Recurrent miscarriage. Sequence of 3 or more consecutive spontaneous miscarriage. Cerclage operation, also called as Shirodrak or McDonald's. Cerclage operation is stitch placed around the cervix to prevent the miscarriage. Like this is uterus. This is somewhat like uterus. This is cervix, then vagina. Okay, here the stitch is placed. Okay, just to avoid the dilatation before the term gestation and to avoid the abortion. Okay, it is called as cerclage operation. Stitch placed around the cervix to prevent the miscarriage. Then we move to cord abnormality. Battle dose placenta. Cord is attached to margin of the placenta. See, this is placenta. This is normal placenta. This is how it should be. Cord should be in the center. But at the margin, it is called as battle dose placenta. Sperm count. Oligospermia is a decreased seminal fluid. Aspermia, absence of seminal fluid. Azoospermia, absence of sperms. Teratospermia, abnormal form of sperms. Oligospermia, decreased sperm count to less than 40k. Next, necrospermia, loss of motility of sperm. Family planning, safest contraceptive is barrier method. Temporary but 100% efficacy model method is oral pills. Most acceptable method is sterilization. Theoretically ideal is intrauterine device like copper T, and most widely used is condoms. Types of pills and contain mini pill, it contains progesterone only. Subdermal implant, progesterone only. Combined pill, estrogen progesterone. Postcoital pill, high doses of estrogen, RU486. Vacation pill, Anordin. Male pill, Gossipol. Non-oxynol 9, today's vaginal contraceptive sponge. One pill missed, take 2 pills next day, one in the morning and one in the evening. Mala N, norethistérone 1.0 mg and ethyl estradiol 0.03 mg. Mala D, D-norgestrol 0.05 mg and ethyl estradiol 0.04 mg inhibits ovulation. Then intrauterine devices, best time for insertion of IUD immediately after menstrual period. Commonest complication of IUD, prolonged or excessive menstrual period. Intrauterine device recommended by ICMR, copper T 200. Mode of action of contraceptive, mini pill, alteration in cervical mucus, endometrium and fallopian tube. Combined pill, inhibition of ovulation. Injectable contraceptives, suppression of ovulation. Intrauterine device, anti-implantation effect on blastocyst and foreign body, reaction in endometrium. Tubectomy, laparoscopic sterilization done by coagulation, bipolar or unipolar application of clips, filshi or halka or bands, Ionor, Fallopi, commonly used method being with fallopian rings. Vasectomy, troublesome complications, sperm granuloma, intercourse can be resumed after 30 ejaculation. Failure method, rhythm method 25 out of 100 women per year. Coitus interrupts 25 out of 100, condoms 10 to 14 out of 100, spermicidal agents 30 out of 100, dodging 40 out of 100, Dutch cap 4 to 6 out of 100, IUCD 2 to 6 out of 100, combined oral pill 0 to 1 out of 100, mini pills 2 to 3 out of 100, nor plants 1 to 2 out of 100.